April is Oral Health Month. The Manitoba Dental Association says we're still not brushing or flossing our teeth right. Many of us are missing key areas in our dental care. And joining us now with important oral health care reminders is dentist Dr. Kelly Regula. Good morning, doctor.
Good morning.
Thank you so much for joining us. Now, we're still not getting this right. Even adults are not, kids, it's understandable, but even grown-ups are not getting it right. What are we doing wrong?
Well, that's a great question. So there's a few things that I think some individuals might be missing out on. One is knowing that you should change your toothbrush every 3 months.
Okay.
So when the bristles start to splay, you'll see here, if bristles start to bend and splay outwards, that toothbrush is probably too old, or you're putting too much pressure.
Okay.
One of my periodontists likes to say, hold your toothbrush either with your non-dominant hand, so if you're right-handed, use your left hand, or hold your toothbrush with 2 fingers and then gently add the other fingers and brush that way. That way you don't put too much pressure.
Because too much pressure is not good for the gums, right?
Correct. And you might also then start to actually erode your tooth.
Which leads to sensitivity and all kinds of other issues. Okay, what else are we doing wrong?
All right, so the other thing is toothbrush too old, bristles starting to splay. The other thing is picking a toothbrush that might have too stiff of bristles. Now, I did do a little visit to Shoppers yesterday to see what was on the aisle.
Right.
I could not find a stiff bristled brush.
Oh, so that's a good sign.
It is, but I found a medium. We never recommend medium.
So medium, no good.
Ultra
always stick
soft
with the soft.
or soft.
Because some people might feel that when the bristles are a little harder that you're getting cleaner, but you're really not. You're just causing damage, right?
Correct. So unfortunately, once you've developed calculus or the hard tartar on your teeth, that needs to be professionally removed.
Okay.
The harder you scrub, you're not going to remove that.
Okay, and so then we also miss certain areas of our mouth, right?
Correct. So I brought a model today, and I thought I could color it with a marker to show you common areas that are missed. So if you look at this dentition, we have all the teeth, and the most common areas to be missed are along the gum line, especially on these upper molars, where I'm painting in purple here, and along the gum line on these lower molars on the inside.
Ooh.
So what you want to do is ensure that when you're doing the upper molars, that you take your brush, I don't know if you can see this.
Just making sure we got this.
You want to close your mouth, because what happens is when you're open, your jaw pushes against your cheek and then you can't reach it.
Right.
So you want to close your mouth, angle your toothbrush at 45 degrees, wiggle, and then brush that off.
Oh, look at that.
Similarly, here you can do it open mouth, but your tongue can sometimes get in the way, so you have to sneak between your tongue, angle your toothbrush, and brush up. So now I'm going ahead to sort of proper brushing technique.
Right.
So if I may, I'll show you.
Please
for
do.
an adult, some people think, my goodness, toothpaste is expensive. I'm going through loads of toothpaste.
You don't need a lot.
You don't need a lot. You just need a pea-sized amount.
That's it.
Very little for an adult.
Okay. And then kids the same?
No, kids is much less.
Oh, interesting.
So a dry grain of rice or a smear.
Wow.
A fluoridated toothpaste. So this is my handy toothpaste here. Again, we're going to angle it along the gum line at 45 degrees, wiggle the toothbrush back and forth, and then brush away from the gums.
Okay.
So oftentimes people are just brushing the tooth, so they're missing that important area.
Which is tucked kind of in and almost like hiding in
under
the
gums. Correct.
Okay, interesting.
So, yes.
So we're almost out of time already.
Boy.
Flossing is also essential, right?
Yes, flossing is very important. The key about flossing is if you don't do it, you're missing a large percentage of your tooth surface.
Okay.
So if you think about it, all this area in between the teeth is missed when you're brushing. So what you want to do is take a string of floss, wrap it around your fingers, go into the embrasure or go between the teeth, wiggle it down, make a C shape, and then shoe shine up and down. So, and then stay in there and go on the other side of the tooth and shoe shine up and down. Very important. Another area people often miss is behind the last tooth, because of course the brush can't get back there. So you want to do behind the last
That's
tooth.
my favorite spot, actually.
Oh, is it?
Okay, so we're almost out of time already. How do we teach this to kids? Do we just do exactly what you just did?
No. So with kids, kids, we love these little floss picks. I myself have a child at home. We say until the child really can cut their own meat, you should be supervising their oral hygiene regimen.
There you go. Thank you for sharing this with us.